Okay, I think panelists, if you are ready to get underway, I think we can get this conversation started. Thank you everyone so much for joining this conversation. My name is John Menino. I'm with the State Innovation Exchange. We are a national organization that's focused on supporting state legislators and advancing progressive policy in the state legislatures across the country. And we are really thrilled to bring this conversation together today with a tremendous set of panelists that are really experts in this space and have some tremendous perspective to bring on the issues of paid family leave and paid sick days. Just to cue up this conversation a little bit, we really wanted to intend this to be a conversation across states. We are seeing so much energy, passion, and movement on these issues in state legislatures across the country. So wanted to use this mid-session opportunity to facilitate a conversation with folks that are interested in advancing this legislation, might be moving this legislation. And I'm also seeing folks on the line that are in states that have had serious success passing and enacting this legislation as well. And I think it's a really tremendous opportunity for us to have this multi-state conversation, to share experience, advice, best practices, and also just kind of get a lay of the land on where the policy advancement is going on nationally in the fight for enacting paid family and medical leave and paid sick days. Before I turn it over to our panelists really quickly, I think we're going to start off with just about 15 minutes or so of just some scene setting national perspective from Rhode Island State Senator Gail Golden, who also is with the Family Values at Work, working on family leave issues nationally. We have Alex Baptiste, Policy Counsel from the National Partnership for Women and Families. And we also are thrilled to have Daniel Atkinson, a founding director of Mothering Justice in Michigan, who's done some tremendous work on the paid sick days issue. So thank you so much for joining. At the moment, everyone is muted, but if you want to join this conversation, again, we are very much intending for this to be a conversation. So just go ahead, there should be a raise your hand button on your screen. And if you go ahead and raise that, we can just cue you on into the conversation. Otherwise, feel free to use your chat panel and ask questions. We'll start with about 15 minutes of scene setting from our panelists, and then we're going to get into a conversation, and we'd really love to hear from all of you. Questions, concerns, challenges, best practices, and everything in between. So with that, I'm going to turn it on over to Rhode Island State Senator Gail Golden to give us a little bit of a rundown on the policy distinction, just set this conversation up.
Thanks so much, John, and I am really happy to be here with all of you. I know some of you are working very actively on all of these policies right now in your states and are experts in your own right. And so some of this is just going to be a very top level, but then we really want to just answer whatever questions, brainstorm whatever you need to help you move forward. So I just want to make sure that we're all on the same page and the language that we're using when we talk about sick time versus paid leave, sometimes called family and medical leave insurance. Sometimes people call it paid family and medical leave, or in Rhode Island, we call it temporary disability insurance and temporary caregiver insurance. So John, if you don't mind just sharing that graphic, is a graphic from Family Values at Work. And, and if you scroll down a little bit, it just, you're welcome to pull this off of our own website, familyvaluesatwork.org, and it just has a very basic explanation. Basically, paid sick time, you have a cold, you need to go to doctor's office, your kid's got the flu, that's when you use your paid sick days, then that's what people are fighting for. Unfortunately, that is not the reality for a majority of Americans, don't have access. Can all take off a day or two or a few hours when they need it. Family and medical leave insurance is for those longer times when you have a medical crisis yourself, you have a heart attack, you break a leg and work construction and you need to be off the job for 6 weeks until your leg heals. That's when you need that level of medical leave. And from a family caregiving side of it, it's when you need to caregive for a new child that enters your home through birth, adoption, or foster care, or to caregive for a family member who's going through their own medical crisis and you want to be there with them to take them to chemotherapy or as they transition out of a rehab facility into the home, those sort of things. So that is the distinction between the two. And we'll get a little deeper into some of the policies next. So if you want to flip to the next screen. Next graphic. So really the thing about about paid leave and paid sick days is you can do, we have some basic principles as we are all talking about these policies in the states. We want to make sure that we're doing things that are good for everybody. Paid sick days has been largely about, that discussion has largely been about the number of days, who is covered by it, how many hours they have to work. It's really a benefit that is the employer providing that benefit. So they're mandated to provide, required to provide a certain amount of sick time, either paid or unpaid, depending on what the state law is. You want to include as many people as possible. And there are a lot of other parameters we put on that, which Danielle could certainly talk about in her experience. But paid leave is an even more complicated policy. And so I just have this up here to kind of help frame the discussion. You know, we want to make sure that when we create paid family and medical leave, we're doing it so that it is available to absolutely everybody. It covers all workers. It covers it for all the kinds of leave that they need it for. And it covers all kinds of families, because we shouldn't be in the business of deciding who you love. We should be able to decide that, we should be able to say that if this is the person you want to care for, you can absolutely use access to this benefit. We want to make sure it's affordable, that it makes sense for employers and employees, and that it has the level of wage replacement that you need, and that you have a job to come back to after you take that leave. And we want to make sure that it gives you enough time either to care for yourself or care for somebody else. And so really, when we're talking about these policy initiatives on the state level, we want to make sure that it has that kind of AAA rating. And I'm done with this segment, so I'll hand it off to Alex.
I think we're actually, are we going to me or Danielle?
Let's go over to Danielle.
Yeah, this is Mr. Plate.
Sorry, I was trying to get off mute. So hello, everyone. It's such a pleasure to be with you, even if it's just for a little bit. I apologize. I double booked it and leaving. I'm at the airport. But really, you know, I think really I was asked to speak about the coalition that we built for paid sick days in Michigan. When I was, you know, thinking in my head about that question, I was thinking about the policy and wanting to reflect the policy in the coalition and having the coalition really reflected in the policy as well. It was always our goal to live up to the AAA rating, and make sure that every possible Michigander was covered by this policy, because everybody gets sick, and not, unfortunately, not everyone has time to get well, as the founding director of Family Values at Work, Ellen Bravo, says all the time. And to really, when we have equity in our heart and we walk with that purpose, it's important to make sure that everyone is able to look at their children or look at their loved ones and look at themselves and say, care is important. And so, you know, I really hope that everyone is leaning into that AAA rating when they're drafting policy, and also when you're building a coalition. And so we've been working on this issue for the past 6 years in Michigan, with a variety of bill sponsors and champions, including now Congresswoman Rashida Tlaib when she was in the state legislature. And we wanted to be hand in glove with the lawmakers. We wanted our coalition and the policy to reflect their district. And so we built a coalition with LGBT community, with the care community, obviously parents being Mothering Justice, and providers and doctors and employers and employees and everyone that's in the community. We felt that was really important for the strength that we would need to mount a campaign, a ballot initiative campaign, but also in the fight that we're in right now, defending a win that has been rolled back a little bit. But we are still knowing that, you know, any argument that is thrown at us, we have a coalition member to really combat that argument. You know, that workers don't want it. Okay, there are workers that do want it. Employers that say that it's unworkable. Here are our coalition of business owners that say this is not only workable but essential to have a successful business. People that say that this is not good enough. You know, we have several members that have chronic illnesses or caring for children with chronic illnesses, saying that this is part of the continuum of care. And so it's really important to have a statewide coalition, make sure that all your bases are covered so that you are also not missing anything in the policy, right? You want to make sure that you don't have somebody who is a coalition, who is a valued member of your community coming in and being, you know what, that policy is bad for these reasons. You really weren't thinking about, you know, the disability community in this policy. So I'm so grateful to have national partners like Family Values at Work and Better Balance to make sure that our policy was right, and so that we were able to build a coalition that was able to win. And so we won, and in winning, and again, we are battling to keep the win that we won last fall. But in the winning, we look to see what is the next thing on the continuum of care, right? And so family leave is the next thing, it's the next fight, and every win sets you up for another win as long as you have the partners alongside you. And one other thing that I wanted to say before I wrap up is that we didn't go, I've been a member of Family Values at Work for a long time, for over 6 years, but we didn't go for earned sick time immediately. That wasn't our first campaign as a coalition. It was built on the value of earned sick time being a policy that we need to work on. We worked on minimum wage first. It was important that we listen to our partners about what was timely and winnable at the time, and that set us up for a campaign that was successful. So if I'm not here for the Q&A, I apologize, but I'm Danielle at motherinjustice.org, and you can feel free to email me with questions.
And Danielle, we'll be sure to circulate all the panelists' contact information after the webinar so we can get those questions. And Gail, we do have a quick question, I believe, for you from Elizabeth. And the question is, if I understood correctly, your state offers both paid sick leave and family medical leave? Paid sick time and medical leave?
Yeah, so Rhode Island is one of the states that has both a paid sick time law and paid family and medical leave. And these issues are sort of go hand in hand. There are 7 locations in the country, 7 states, including DC, with family medical leave, and I think over 40 with states and municipalities with sick time. So there is kind of a lot of overlap, but but plenty of places have one or the other.
Great, thank you. And we will queue it up, go over to Alex Baptiste from the National Partnership on Women and Families. But I just want to, before we toss it over to Alex, I think, who will talk kind of about the national context, looking at the attendees, I mean, we have folks nationally on this call, Florida, Washington, Nebraska, Iowa, Vermont, Michigan, which really underscores just the nationwide interest in energy around this. So Alex, I will toss it over to you.
Thank you, John, and thank you so much for having me. So as John said, I'm Alex Baptiste. I'm a policy counsel here at the National Partnership for Women and Families, where I focus primarily on paid sick days and dabble a little bit in paid family and medical leave. And I'm just going to kind of set the scene for what we've seen nationwide since sessions began in January, to kind of go over like the movement and the incredible progress that has been made in the introduction of paid sick days and paid family and medical leave bills. We've seen a lot of momentum this session with multiple bills being introduced in legislatures across the country focusing on these 2 issues, spanning on everything from new bills to expansions to studies to basically anything that can really kind of push these policies forward and make it very clear that they are a priority in legislatures. In related to paid sick days, we've had 13 states introduce paid sick days bills. They range from, again, new bills entirely. Some are amendments to existing policy. We have one bill in California that was introduced that is an amendment to the paid sick days bill there to change the gender pronouns to theirs and their. And then additionally, some other expansions of already existing paid sick days laws. In terms of active campaigns, there's a lot of really great momentum as well. There are campaigns in Minnesota, which is currently working on a statewide campaign after having 3 cities, Duluth, St. Paul, and Minneapolis, passed their local paid sick days laws within the last few years. So it's really exciting to see them build off of the progress that they've already made, and then have that foundation to introduce a statewide campaign. We're also seeing a statewide campaign in Nevada. Their bill was introduced earlier this week. And there's also a statewide campaign in Maine, as well as a campaign in Portland, Maine, which is really exciting. So it's really great to see it both at the local and at the state level. And then I know that Albany, New York is also trying to move a paid sick days legislation bill, which would be really exciting. Westchester, New York passed one last session. So it's really, again, great to see legislatures building on platforms that are already established and recognizing the success of these bills. In terms of paid family and medical leave, we've seen a lot of bills introduced, for almost double the amount that we've seen for paid sick days. 27 states have introduced bills that are related to paid family and medical leave, which is a bit of a change of pace from the last few years. I think we've generally seen a trend of paid sick days bills being more represented in state legislatures, but now with all the national attention that's going towards paid family and medical leave, as well as parental leave, a lot of legislators, both at the state and at the federal level, are starting to make paid family and medical leave part of their platform when they run for office. So it's gaining a lot of attention and a lot of momentum and a lot of support, which is really exciting. Again, the bills range from new paid family and medical leave policies to studies on how such a policy would work within the local jurisdiction, whether again it's local or whether it's statewide. Also, we're seeing expansion of existing laws. Again, California also introduced a bill that would change the benefit amount, which is great. New Jersey actually just passed an expansion bill, law for their paid family and medical leave law, which is great. And also we've seen paid family and medical leave bills introduced that are geared specifically towards industries or types of workers who in a lot of instances would kind of be left out of paid family and medical leave bills. So again, it's great to see that the momentum isn't just there to introduce the bill, but also to cover as many workers as possible, because as everybody has heard, everybody gets sick. At some point, you need to take care of yourself or a family member, and it's really crucial that these policies touch as many workers as possible. In terms of active campaigns, I know that there are campaigns going on in Colorado and Oregon, as well as Connecticut and New Hampshire. So there's definitely been a lot of really great momentum nationwide, which is really exciting to see.
Great, thanks, Alex. And Gail, I'm going to toss it over back to you for a little bit of the scene setting for the grassroots support that's going on across the country, particularly that Family Values at Work is engaged in. And then we've already got a number of questions lined up in the queue, which we'll get to right after that.
Great. So you already heard from Danielle, and Family Values at Work is, I have the pleasure of living my values as a state senator and also doing it in my role as Family Values at Work. And Family Values at Work is a national network of 27 state-based coalitions that work on paid leave and paid sick days. And Danielle at Mothering Justice is the lead in one of our coalitions in her state. And that's really just an example of what she was talking about is really an example of what's going on in partnership with many legislators across the country, is this the advocacy and grassroots coalition building that is building momentum for these bills. And that is why we've seen so many new bills introduced on the state level, particularly on paid family and medical leave. It's a complex policy. You need a lot of people behind you supporting you. And this is what our grassroots advocacy looks like. It involves parents and physicians and labor unions and small businesses and any kind of group of seniors and childcare providers and people who are just in many different ways affected by not having access to paid leave. And they come together and they work in coalition, often with legislators, to develop a best plan for how to move legislation forward. And so that's really what when bills are getting to a tipping point, it is often the work of those grassroots organizations that are pushing behind it. So I'm happy to connect you up if you don't know who those are in your states. If you're in one of those 27 states, there are certainly people doing this in other states as well. But that's all available in our Family Values at Work website as well.
Thank you. And now we've got a few questions in the queue already. So I'm actually going to queue in Hannah Murdoch, it looks like from Nebraska, to ask a question about their family leave bill. So Hannah, I think you are on mute. So if you can unmute yourself, I think we will be able to hear your question live on the air. Hannah, are you there? Oh, maybe I have to unmute you. Let's see. All right, now try. Hannah, are you there? All right, well, tell you what, I will actually just read the question that was chatted in from Hannah. We've been working hard on paid family and medical leave here in Nebraska. This year's version of our bill had 12 weeks personal medical leave disability, and we continually heard back that it was too long. An amendment was brought to bring it down to 6 weeks. What results or feedback have you seen with Rhode Island's 30 weeks for disability? And conversely, the 4 weeks family care pay is relatively short in comparison with other states that have these programs. Has there been any movement to increase the amount of weeks for family leave?
Yeah, so I think this is a perfect example of how how the people don't quite understand the complexity of really what goes on behind the scenes in family and medical leave. And this is one of the ways that opposition uses the complexity of the policy against us. And so, you know, it's really exciting to see Nebraska taking this conversation on and getting it to the floor yesterday for a floor debate. So Rhode Island has had 30 weeks of disability insurance since 1942. And the eventually get 30 weeks if you qualify. But the way you qualify for the benefit is medical determination from your clinician. Then it's reviewed by a clinical team. Our insurance is fully state run. There's a clinical team that reviews it. There is an assessment of how much time you actually qualify for. And that's also held against a standard, an objective standard set by the insurance industry, much in the way that the health world has codes to determine diagnostics. Those are also tied into saying, okay, well, if you're diabetic and this thing happens to you, you're most likely need a little bit longer than somebody else. And that formula all works together to determine what the length of leave is. So you don't just say, I want 10 weeks, 12 weeks, 30 weeks. It's what you're actually clinically able to, the clinical assessment of the amount of time you need in order to be out of work. In Rhode Island, you know, that varies how many weeks on average it is, you know, but it's usually anywhere from 10 to 13 weeks is an annual average of how many weeks people are out on leave. And for the family caregiving, I have been working ever since I originally passed that bill to expand the amount of leave. It passed the Senate with 8 weeks and was cut by the House to 4 weeks. And so, so that is in itself, I feel too short. But on top of that is the reality that if you are a birthing parent, you have access to the disability portion. So you have that for associated with any disability with your pregnancy. And usually that's 6 to 8 weeks post labor and delivery. If you're on bed rest ahead of time and need to be, then you have however many weeks that is ahead of time. And then you get the additional 4 weeks that's job protected to care for that child. And your other partner, the other parent of that child, also gets the additional caregiving time. So it is, I think anything short of 12 weeks, frankly, is too short. It doesn't actually address the needs that people have. And in order to set up these programs anyway, you have to do the work to do it, so you might as well do it right.
And for those of you listening in, we would love to hear your questions. We've already got a few in the queue, and so I'm going to call out Elizabeth Guzman's question. For states that don't have either of these policies, are there considerations for what should be first? Should you go paid sick leave, family medical leave? Is there some, what is the conversation like there?
Is Danielle still on?
Hey,
Danielle, we can
a little bit.
Danielle, we're having
okay. Maybe Gail can answer.
Yeah.
Oh, okay. I just would love to. It's a shame that that doesn't. We couldn't really hear Danielle because I'd really love to hear from her experience. I think that this has to do with a few different factors. You know, what do you think is more possible to get done in your state where there's more advocacy support to be able to make this happen? The reality is our workforce needs both of these things. So both of them are good ideas. And states have tried it different ways. We, for a few years, saw far more states introducing sick time after it originally passed in Connecticut. And then because there has been more national attention to paid family leave, I think that there's just more people talking about it. And as the states like Massachusetts and Washington, who are the latest two states to pass paid leave, they did so with bipartisan support. And I think that has really been a game changer, that people realize that paid leave is not tied to one party. When a Republican governor signs it in Massachusetts, it's an indicator, and we see bipartisan and tripartisan support in different states, that, you know, it's an indicator that that's a winnable policy no matter where you are pushing it.
Great, thank you. And for folks listening in, I mean, feel free to raise your hand and engage with any of these questions. I know it looks like we have folks from like over a dozen states who are actively working on this as well. So we'd love to hear your perspective on the ground in various state legislatures across the country. One of the questions that I wanted to lift up is what are the best approaches and strategies for messaging? How are you framing these out on the doors, out in the media, and what is that top level framing and messaging points that you're going in with when you're advancing these bills?
I can say from the work that I've done on the paid sick days, a lot of the top messaging revolves around, similar to what you hear of paid family and medical leave as well, is that at some point everybody is going to get sick. And being put into the position of having to choose between your paycheck or taking care of yourself or your child is really damaging to that individual person's economic security. It's damaging to the family's economic security. And at the end of the day, it's just really not right. Nobody should be put in that kind of an impossible position. So I think when you frame it to be on a much more granular level, when it's more personal, where people can really relate to the fact that, oh yes, you know, that one time that I got sick, I needed to take a couple of days off, or I felt bad when I had to send my child to school when he wasn't feeling well, but I couldn't take the time off. That's when I think a lot of people really start to understand the gravity and the actual real need of these policies. So I think really forming them to hit home on the personal level allows people to relate to it a little bit more and really get behind the issues.
Hey, this is Danielle. I don't know if you could hear me. But yes, I would agree with what Alex is saying. But our best message, like our worst messages, still beat their best messages. And I think, you know, things to stay away from is, you know, the widget argument about people people going to work. It works, but it's really about our values, and we need to lead with our values. People understand and relate to those. And I think the only argument that you need to be concerned about is it's going to cost business. And again, our worst messages beat their best.
Well, on that cost piece, I mean, we have a question from Joyce in Vermont, and her question is, Vermont is looking at relatively high administrative costs for our paid family and medical leave proposal because we're a small state. Does anyone have thoughts about relative cost of state-run versus third-party administrator programs?
Yeah, so that's a great question, and I have a lot of thoughts on it. We are also a small state, and the cost estimates that have been done in these so far to help every state figure out how much paid leave will cost are based on the administrative overhead in Rhode Island and California, which are both publicly run state insurance pools that average about 5% administrative cost and have been that for decades. I point that out because obviously California and Rhode Island are very, very different in the size of both geographically, but also in the size of our population. We're about 1 million people in Rhode Island. And so it is an incredibly cost-efficient way to run a program, to run it through the government. We have seen this in other ways that government outsources government function, that ultimately we are baking in additional costs because there's a profit margin, and we bake in inequality when we do so. Even if you were to create a third-party administrator in your state, there would be an incredible cost of enforcement as well that would have to be borne by the state. Otherwise, you would be most certainly creating inequality and making it less accessible. I think much like people are now understanding the real risk of privatizing our prison system, the risks of, we have the constant attacks on privatizing our social security system. I mean, that's all the same thing. We need to make sure that we're creating a benefit that people can afford and they can actually access. We simply don't know what the cost of doing a third-party administrator would be, but it would, how much additionally would be, but certainly that is baking in a profit margin where there absolutely shouldn't be one.
Thank you. In talking about kind of the coalition environment and building a broad support structure for these bills, Gail or Danielle or Alex as well, I wonder if you could talk about strategies for bringing in supportive small business voices and adding that voice to your coalition and the support for the bills. So I don't know, Danielle, if you're there, if you want to take that, or Gail or Alex.
And smaller items such as three cases versus.
I think we lost Danielle there for a second. So.
Okay. Well, I will say Vermont is a great example. I mean, that coalition is being brought together by small business at Main Street Alliance, and we have had many small businesses actively engaged across the country. A little bit into that messaging question. When you have a state-run social insurance pool, as we have been seeing in the states, you're leveling the risk and you're pooling everybody together, and large corporations may have the cash flow to be able to provide this benefit already. Whether or not they do, it's the reality of business that they're far more likely to be able to take on that risk than small businesses can. And that's why we've really seen small businesses like going on in Vermont come to the table and advocate for this policy change, because they want to be able to provide that benefit. Often they are the closest to their employees and view them as family, and want to make sure that their employees are able to take that time off when their spouse gets breast cancer or their child is in the hospital. So they're, we see them as great allies and are very able to help push back a lot on the opposition narrative.
And Gail, we have a follow-up question from Joyce in Vermont. So I think I'm just going to try again and cue Joyce into the conversation, and hopefully this works. So Joyce, I'm bringing you in and I'm going to unmute your line. So go ahead and speak and see if we can hear you on the line here. Joyce, are you there? Huh. I wonder why that's happening. Well, I can read out Joyce's question here. More on Vermont, but Rhode Island was able to build on its TDI program, whereas we were starting from scratch. IT costs are ballpark of about 12 to 15 million, and funding reserves about 88 million. That's 100 million upfront before benefits begin. A third party administrator would spread those costs across time. Don't know if you have a response to that or want to dig in there.
Yeah, and Joyce, I don't know who you are, but I'm more than happy to follow up and have a much more detailed conversation with you about this. In the broad sense, I will say that while we are one of the states that originally had a TDI system, and so you can't look at those cost modeling directly. If you look at what's going on in Washington and Massachusetts, because those are, they started from zero as well with no TDI system. You know, that IT is a front-loaded cost that can be amortized over time. And then what we have seen in the states that as they're starting up, you start up collecting of payment into the system ahead of time. For some of them have chosen to do 1 year or 2 years. So that you have that cushion to pay out benefits going forward. I think there's a real distinction here between startup costs, which are just getting people the IT investment, the original staffing in place, so you get rules and regulations, you get the outreach going, you have the mechanisms in place to start everything up, and then the ongoing costs, which involves hiring more staff to be able to run it as the benefits are being paid out. But it's not everything all on day one. It's staggered over the course of a couple of years. We've also seen from Washington State that their original fiscal note, which I cannot remember off the top of my head exactly what it was, but actually that as they're implementing it, the costs have been lower than what their original fiscal note had been. So for the state of Washington, they borrowed against the general fund and have been paying it back in as they when they start collecting payments into the fund before they've given themselves enough lead time before they will be paying out benefits.
And I do want to call out some additional commentary from Hannah in Nebraska on this subject. Is here in Nebraska, they're in the same boat. We were able to work with our Department of Labor to come to an agreement that they could build the IT system off of the existing system for unemployment benefits through the same vendor, which significantly lowered costs. So some creative solutions, it sounds like, they're in Nebraska.
Yeah, and there is a lot of, I think that's a really good point, and thanks for bringing that up, because, you know, a lot of the data that you use to back end the wage information in order to figure out what wages you were replacing do come from unemployment insurance. That's also one of the complexities about having a third-party administrator. There are a lot of laws and regulation on what information you actually can share with a third-party administrator or any private party about that unemployment insurance. And so if you're able to dovetail the IT, that is not only a cost savings, it's actually the information you need.
And just pivoting a little bit in thinking through the legislators that might be in the early stages of thinking about this legislation, like what are the resources that are out there, knowing that so many states are working on this? What are the types of policy resources, either that Family Values at Work, National Partnership? I can give a little bit on SIX's resources as well, but would love to hear where they might go, how they might approach that in terms of the policy, messaging, polling, everything in between, where that might be easily accessible for thinking about the starting phases of these conversations.
I can start with a little bit of information from the National Partnership. We have, first and foremost, our model legislation that we have available to folks who are looking to get into introduce these campaigns that we drafted with a couple of coalition partners that really outline basically what policy should be looking at. And then we also have a really strong coalition of other organizations that we work with on both paid family and medical leave, unpaid sick days, and a number of other issues where we can connect a lot of folks who are working on campaigns, whether that be state legislators or folks on the ground and doing grassroots work with folks who have that kind of data research capacity, who have done polling on the benefits of paid sick days and paid family and medical leave, who have done polling in terms of how voters would, whether or not the support for both measures. So a lot of that is available on our website, but we're also, if any emails that come our way, we're very happy to answer as well.
And from Family Values at Work, as a legislator, I sort of have a foot in both sides of this discussion from both an advocacy standpoint of Family Values at Work and as a legislator. And so what I try and do is use my role as a way to help the advocacy coalitions and legislators better understand how they can work together to pass these policies, and really help you think about what else has been running in other states and what policy questions have come up and how other state legislators have helped address that, or how the advocacy coalitions have helped address that. So I'm happy, please do reach out with any questions that you have. Our Family Values at Work website has a bunch of resources on it as well. Some of it is just graphics to help you explain to people very quickly what you're trying to get to. There are also a lot of fact sheets and talking points about paid leave and paid sick time, which, just so you can inform yourself, inform your colleagues, and figure out other ways to talk about this.
And just generally at SIX, I'll flag that we are a support and resource center on a broad slate of issues, paid family leave and paid sick days included. We work closely in concert with the National Partnership, Family Values at Work, and others. But we're also, I like to think we play a bit of an operator role too. So if you're not sure where to go for resources, we can help you kind of navigate the broader national partner and in-state partner environment as well. Definitely want to work in concert with all the folks that are doing great work on this already. And then one general question that I wanted to put out there for our panelists, but also for folks on the line. I know there are legislators on the line that are deep in working on these bills or have already passed them. So really be curious to hear the thoughts from the audience as well. But what are some stumbling blocks or challenges that you might run into in advancing this? And are there strategies for preventing them before you might run into them? I see a hand raised in the audience from Elizabeth. So I'm going to cue Elizabeth into the conversation. Elizabeth, are you there?
Yes, I'm here. Can you guys hear me?
Yes.
Okay. So I have presented paid sick leave for 2 years in a row. And unfortunately, my bill was killed on party line votes in a majority Republican state legislature. And some of the pushback that we get is the Chamber of Commerce. For example, the Chamber of Commerce, they come, and even though many of their members offer paid sick leave programs, their pushback is that, no, that's going to ruin our businesses. That's not something that we're interested in. And this year, for the first time, one of my colleagues presented a family paid medical leave, and both bills were laid on the table, and it was decided that we will do a study. But we always have the pushback from the Chamber of Commerce for both cases.
Yeah, this is Alex. I would definitely echo what Elizabeth said. A lot of the pushback that we see is generally from local business coalitions within the jurisdictions where their campaigns are going on. And it can be really difficult because depending on who is leading that charge, there may be more money on the opposite side who may be better connected to legislators. So it can be a very real challenge. But we have, as Gail was saying about what Family Values at Work has on their website, we also have a number of fact sheets on the National Partnership website that break down the actual benefits of paid family and medical leave and paid sick days for businesses and how it actually boosts productivity and strengthens local economies. So that's generally how we try to get around them with additional information, but also raising up experiences of local business owners, small, mid-sized, large business owners who have implemented these policies or work or own their businesses in these jurisdictions to show that they're not quite the budget busters that people expect them to be or claim that they will be, and that they really do help their workers. It's a moral issue for a lot of them, as Danielle was saying earlier. And that actually ends up being a great benefit that they can provide to their workers and allows them to maintain their staff and really build a more cohesive environment for everybody.
I totally agree with Alex. And I think the thing to recognize is that is a coordinated opposition tactic from around the country. So those Chamber of Commerce, the NFIB, SHRM, they were working on a national level and are theoretically representing local business, but it is a coordinated effort to undermine your capacity to get good bills across to your governor's desk that have to do with things that actually will improve the quality of life for your workforce. So, you know, I think that's one thing to keep in mind. The other thing is the facts and data are on our side. Unfortunately, sometimes facts and data don't work in the face of fake news, but you have to, we do have them on our side. And one of the things that I like to point out to people is that's absolutely what the opposition messaging was on paid family leave in Rhode Island when we passed the expansion to create the family leave part in 2013. And at that time, our unemployment rate in the state was 9%, and now it's below 4%. So clearly it has not been a jobs killer. We also passed paid sick days in that amount of time as well. So the reality is, if you just look at employment in our states that do have these policies, their fear tactics don't bear out.
And I think this is a good time to call out some of the national partners that like Main Street Alliance that was mentioned earlier, and that there are these more progressively oriented small business alliances that can be at times relied upon to bring members to testify and do the good work of supporting and bringing the small business voice forward. Main Street Alliance, Small Business Majority, American Sustainable Business Council, just to name a few, that have done this work to organize and support small business owners so that they can go in and support you in testimony and in your coalition. So I think they're doing amazing work. We are close to wrapping up here. I want to call out for the audience, if there are any additional questions, feel free to toss them out now. As we I think we can start wrapping up here. I just want to toss it back to our panelists to see if there are any particularly closing thoughts that you might have, or additional things that we didn't get to in this conversation that you thought were worth bringing up here, as we've got about 26 people on the line. Alex, let's go over to you first, if that's okay.
Sure. Yeah, I think in terms of closing statements, one of the best things that folks can do if they're interested in looking at these policies is really going back and seeing what other campaigns and legislatures have done in the past to be successful. I think that's the best way that you can learn. And as Danielle said earlier, even our worst arguments are better than the opposition's best. So, obviously all the information supports how effective these policies are and how beneficial they are. But there's never anything quite like knowing the experience of folks who have done it before. And that's where, organizations like Family Values at Work or National Partnership are definitely poised to assist in terms of making those connections. Because I think by learning from others, either missteps or the hurdles that they've overcome, I think that only makes the path a little bit easier for folks in the future.
Totally, thank you. And we actually have a really good question, again, from the audience. Thank you, Joyce. The governors of New Hampshire and Vermont have proposed a voluntary paid family and medical leave program. What are your thoughts?
So I think that the good news about that is it's really interesting that we've seen 2 Republican governors try and figure out a way to address paid leave. I think they've done so because of an extraordinary amount of political pressure from largely Democratic legislators, but certainly in Vermont, we see tripartisan support for legislation in those states. In that state. So, I think that's a political calculation on their part. If you're looking at it from a policy standpoint, voluntary programs don't work because either you're all in an insurance pool or the people who, if it's voluntary, the people who are going to need it are the people who purchase it. The reality is insurance works when you spread the risk. And so you don't want to make this something that is unaffordable. I know that those requests for information put out by the two governors do have the proposals back, and I haven't had a chance this week to really go through them. But I believe they're already, even their voluntary plans that they're talking about are more expensive than what was originally costed out in Vermont, although I don't have those numbers side by side. I think the important thing to know is that aside from it just being voluntary, those are private insurance plans, and private insurance and what is required by the states that have paid family leave are different. They're different things. We are not setting up programs that allow people to charge women more or exclude certain pre-existing conditions or otherwise make it difficult for people to access the benefit. We're trying to get people the benefit. Those private insurance products are tilted the other direction. And so it's not just only the concept of voluntary won't work, it's the product that they're providing is not putting the residents of your state front forward. It's putting a for-profit company in the face of it.
Thank you, Gail. I still would love any last questions from the audience if you have them. Actually, it looks like one just came in. Do you know of any coalitions or movements for paid family and medical leave or paid sick days in Florida?
I would love to connect you up there. I believe that the Black Women's Roundtable has been working in Florida, and one of my colleagues has their contact information, has been in closer contact with them. And I'm happy to connect you if you just email me at gail@familyvalues.org, and or if you can share our contact information, I will follow that up.
Yep, and I will certainly send the contact information for all of our panelists to everyone that registered and participated today. Gail, any last closing thoughts before we wrap up this conversation?
Thank you so much for having me on. These are such important policies, and I thank all of you for jumping on this webinar to have this conversation with us. It's so important to be able to see the difference you can make in people's lives as a legislator. So I was first elected in 2012, went into office in 2013, and passed paid family leave in 2013. And of all the things I've done, I still have people come up to me and thank me because I made a difference in their lives. We vote on bills every single day, and certainly we're making differences in people's lives, but this really resonates. So if somebody tells you that, a pregnant woman tells you her baby's name before she tells her mother what she's planning on naming that baby, it obviously really resonates with people. We all have had life experiences in which we know we really need this. These are life changers, and something that you can take on that actually is deeply meaningful, regardless of if you're in a swing state, a swing district, a solid blue one, whatever. This is something that people really, really believe in, regardless of their other political ideology.
Well, I want to thank everyone for joining this conversation. A huge thank you to Senator Golden, Alex Baptiste at the National Partnership for Women and Families, and Danielle Atkinson at Mothering Justice. Again, I will send out contact information, so if you have specific follow-up questions for our panelists, I strongly encourage you to do that. And then lastly, I want to thank you for joining this conversation and for your energy, interest, and passion on this incredibly important issue. If there's anything else that SIX can do to support you as you advance and work on these bills or any others, please do not hesitate to reach out. We exist here to support you in the day-to-day and year-round work that you are doing in your legislatures. So thank you panelists, and we'll be in touch over email.
Thanks. Bye.